Hey everyone, and welcome to this explainer. Let's just dive right in, shall we? Hip pain is literally one of the most common reasons people end up visiting their doctor or physio. But trying to navigate the endless sea of advice, guidelines, and treatments, honestly, it can feel totally overwhelming. So today, we're going to demystify hip pain using really clear, evidence-based guidelines straight from sources like the National Institute for Health and Care Excellence, or NICE for short. Whether you're just starting to feel that first twinge of pain or you already have a hip replacement, we are going to map out this journey step by step so you have exactly what you need to know.
So here is the escalation pyramid we'll be climbing today. We'll start with number 1, the baseline. Then number 2, first-line defense. Number 3, the medical step-up. Number 4, the surgical threshold. And finally, number 5, the post-op alert. All right, let's hit section 1, the baseline, diagnosing the pain.
Let's start by busting a major myth about our primary culprit here. For adults over 45, the absolute most common cause of hip pain is osteoarthritis. This is wear-related joint damage. It's the exact thing causing that incredibly frustrating triad of pain, stiffness, and reduced movement. But you might be wondering, how do we actually confirm this is what you have? Well, get this. According to the NICE NG226 guidelines, osteoarthritis can usually be diagnosed clinically, completely without an X-ray. No way, right? But it's true. If you are 45 or older, you have activity-related joint pain, and you experience either no morning stiffness at all or stiffness that lasts under 30 minutes, a clinical diagnosis is literally all you need. This is a brilliant shift in guidance because it saves you so much time, unnecessary radiation, and of course, the anxiety of sitting around waiting for scan results.
Moving right along to section 2, first-line defense, what you can do today.
Okay, this is probably the most empowering part of our whole explainer. The guidelines state, plain as day, that therapeutic exercise and weight management are the core, first-line treatments for osteoarthritis. Notice what's missing? Not pills, not injections. Movement and weight loss are the absolute gold standard here. Dropping excess weight significantly reduces the mechanical load running right through your hip joint. It improves function and really paves the way for much better mobility overall.
So, how do we actually put that into action? Well, here are 5 simple daily physiotherapy exercises you can do right in your living room. Number 1, the kneeling hip flexor stretch. Number 2, bridging on your back. Great for strengthening those glutes. Number 3, standing hip abduction, which is basically just lifting your leg out to the side. Number 4, the sit to stand from a regular chair. And number 5, the clamshell while lying on your side. You'll want to aim for 2 to 3 sets of 10 reps most days. And hey, quick side note, a little bit of discomfort during exercise, that's entirely expected and totally safe. But if you feel a sharp or worsening pain afterward, that's your body's cue to ease off and maybe get a physio's advice.
All right, section 3, the medical step-up, navigating pain medication.
But hey, sometimes, despite our absolute best efforts, exercise just isn't quite enough, and that brings a massive shift in how we actually treat joint pain. On one hand, NICE highly recommends topical NSAIDs, think ibuprofen gel, as a first-line medication. If that doesn't do the trick, oral NSAIDs can be considered. But crucially, they need to be taken alongside a stomach-protecting medicine, like a proton pump inhibitor. Now, on the flip side, NICE explicitly advises against routinely offering paracetamol for osteoarthritis. Why? Because there's just no strong evidence of benefit. They also strongly advise against strong opioids and glucosamine. I know, it's a surprising update, but it's vital to keep in mind. Now, straightforward osteoarthritis? That's not nerve pain. But what if you have a burning, shooting nerve component or maybe persistent pain after a hip surgery? Well, that's where neuropathic pain medicines come into play. We're talking things like amitriptyline, duloxetine, gabapentin, or pregabalin. These are always started at very low doses and increased gradually, and this is absolutely crucial. The guidelines state you should never combine more than one of these drugs together unless you are under direct specialist advice.
Moving up the pyramid to section 4, the surgical threshold, reclaiming quality of life. So, we're shifting our focus to surgical intervention now. When is a hip replacement actually considered? It's not just some strict timeline you hit. The guidelines emphasize that joint symptoms must be substantially affecting your quality of life. Plus, you must have tried structured conservative management first, the physio and weight management we just went over. In practice, many NHS boards look for specific criteria before approving surgery. That includes BMI thresholds, often below 35, and most importantly, shared decision-making. Surgery is elective, right? Your personal priorities and your willingness to accept surgical risks matter just as much as whatever the clinical findings say.
And there's a specific number you should know: 30. More specifically, an Oxford hip score dropping below 30. This score is a major benchmark used by a lot of healthcare boards. When your score dips below this number, it's telling us that the hip pain is having a significant negative impact on your daily function and your ability to sleep. It's a huge indicator that, yeah, it might be time to seriously consider surgery.
Now, if you do opt for surgery, I've got an incredibly reassuring statistic for you. 15. A total hip replacement is literally one of the most successful operations in modern medicine. Once you get a modern artificial hip implant, it's generally expected to last 15 years or more.
Finally, Section 5, the post-op alert, red flags for replaced hips. For those of you watching who already have a hip replacement, listen closely. It's a terrifying thought, right? Is my joint replacement failing? If you have new or worsening pain in a joint that has already been replaced, it is completely natural to worry. And let me be crystal clear about this. It is never something you should just ignore.
Basically, there are 3 common reasons a replaced hip might start hurting. First up, aseptic loosening. This is the single most common reason for revision surgery. The implant just gradually loosens from the bone over a period of years. Second, infection. Now, this can happen acutely right after the surgery, or it can show up as a low-grade ache months or even years later. And third, dislocation. This is where the joint actually slips out of place. It's most common in the first 3 months post-op, and it presents with sudden, really severe pain.
We really need to take these urgent red flags seriously. If you experience a fever, a hot or swollen joint, literally any wound discharge, a sudden inability to bear weight on that leg, or you feel a very noticeable clunk or instability, these demand a same-day medical assessment from your GP or your orthopedic team. Seriously, do not try to wait these symptoms out. Now, just before we wrap up, I want to briefly touch on alternative options to clear up some widespread confusion I see all the time. What about supplements? Well, turmeric does have some, albeit inconsistent and low-quality evidence for a modest reduction in pain, but it isn't officially part of NICE's recommended management. And as we mentioned a bit earlier, glucosamine and chondroitin are officially not recommended by NICE simply due to a total lack of strong clinical support. So, I want to leave you with this final kind of provocative thought. As you navigate your own patient journey, ask yourself, is surgery a last resort failure? Or is it a deliberate, empowering choice to reclaim your quality of life? Look, most hip pain responds wonderfully to movement, exercise, and weight management. But if you do hit that surgical threshold, know that there is a highly successful path waiting for you. Take some time to reflect on your own pain management journey, talk it out with your doctor, and seek the right help. Thank you so much for joining me on this explainer, and keep learning.